Hi, my name is Dr. Wes, and today we're going to discuss adenitis and neuronal linkage. So, what is adenitis? It's an inflammation of one or more lymph nodes. In routine clinical usage, it is often referred to as lymphadenitis. Common clinical forms are cervical adenitis, mesenteric adenitis, suppurative adenitis. Generalized lymph node swelling needs systemic evaluation. Causes and immune pathogenesis. The causes include viral infection, bacterial infections, dental, tonsillar, skin infection, tuberculosis or atypical mycobacteria, autoimmune disease, and rarely lymphoma or metastatic cancer. The pathogenesis include the pathogens or tissue injury, immune cell activation, cytokine release, uh, node swelling plus pain, prostaglandin, bradykinin, and histamines sensitize pain receptor, TNF-α, IL-1 beta, IL-6 uh, are the inflammatory cytokines or pro-inflammatory cytokines, and chemokines amplify inflammation. Substance P, CGRP can strengthen neurogenic inflammation. Neuronal role in adenitis, that is the neuronal linkage mechanism. Uh, Inflamed lymph node releases inflammatory cytokines or chemicals. These chemicals activate nearby sensory nociceptor. Signal travels through these peripheral nerves to the spinal cord and brain. Brain interrupt these signals as pain or tenderness. Repeated stimulation causes uh, peripheral sensitization and hyperalgesia. Cervical adenitis, swollen cervical nodes, nociceptor in skin, fascia, muscle, and lymph node capsules are stimulated. Pain may increase with the neck movement or swelling. Pain in adenitis is produced by immune mediated sensitization of local sensory nerves. Mesenteric adenitis, these are the inflammation of lymph nodes of abdominal area. Pain can localize to the right lower abdomen and mimic the pain of appendicitis. Autonomic symptoms may include nausea, vomiting, diarrhea, and fever. Imaging can help differentiate from surgical causes when presentation is unclear. Clinical features are the common features: uh, swollen node or gland, pain, tenderness, fever, redness or warmth, sore throat, dental pain, abdominal pain in mesenteric adenitis. Warning signs that are especially important: rapid enlargement, high fever or toxicity, pus or abscess, hard or fixed node, weight loss or night sweat, persistent swelling for weeks. Diagnosis: first of all, you have to take the history. A clear history should be taken by the patient. Physical exam: size, tenderness, mobility, warmth, drainage, regional infection source. Laboratory tests: CBC, CRP, ESR should be recommended to the patient. Imaging like CT, ultrasound, biopsy. If the node are persistent, hard, fixed, unexplained, then biopsy should be referred. Treatment: supportive care, rest, hydration, analgesic anti-inflammatory drugs, and warm compresses for localized tenderness. Cause: direct care, antibiotic if the bacterial lymphadenitis is likely. Treat dental, throat, skin, ear, or GI sores. TB atypical mycobacteria required specific treatment. Procedure: if the nodes are unclear, hard, and the patient feeling the tenderness and unable to move the neck region or the area in which the swelling is persistent and tenderness is feeling, biopsy should be recommended for that patient. Summary: trigger infection, injury, lymph node inflammation by the pro-inflammatory cytokines or chemicals, mediator PGB key cytokines, sensory nerves, nociceptors, spinal cord, and brain. Symptoms include pain and tenderness. That is the cervical adenitis, local neck sensory nerves, tenderness, pain, movement, swelling, possible refer to ear, jaw discomfort. Mesenteric adenitis, visceral afferent nerves are there. Uh, Right lower abdominal pain, nausea, vomiting, diarrhea that can mimic the appendicitis uh, in patients. Thanks and regards. Please like and subscribe this channel. Thanks again. Meet you in next discussion.